Hey guys, so my presentation is on Dr. Kenneth Reeve. Um, Dr. Reeve is a board certified behavior analyst on the doctoral level. He received his PhD from City University of New York in developmental disabilities, and he has co authored a book that is a book of terminology in the ABA field called Behavior Speak. He is currently the director of research at Caldwell University for the Center for Autism and Applied Behavior Analysis. Dr. Reeve, he conducts and presents regularly his research on stimulus control and just different teaching strategies for children with autism and related disorders. He also serves as a research consultant for children with pervasive developmental disabilities in different early intervention agencies. So, just some things that Dr. Reeve contributed to literature would be just different common elements in creating and categorizing a generalized repertoire and using these repertoires to teach skills such as sharing, helping behaviors, like helping their parents or helping their teachers with getting items, picking up items, clean up the classroom, which also led into teaching children with autism safety skills. So, one study I found that Dr. Reeve and his colleagues did was on the formation of a generalized repertoire and the effects training with multiple domain samples and comparisons. This study was similar in how to teach the generalized repertoires, but the difference was in the population. Instead of being children with autism, it was undergraduates at Queens College. And he examined how to teach these generalized repertoires across all settings, like novel settings and familiar settings at the university as well. So just some questions I came up with for Dr. Reeve were: what made you use generalized repertoires to teach children with autism safety skills? Like what inspired him, or what did he see in the literature that made him come up with using those repertoires to teach children? And do you think that there's a correlation between helper behavior or safety skills and adaptive skills? So, adaptive skills or adaptive behavior, meaning those independent daily living skills, such as brushing their teeth or just different other hygiene skills like that. And if there is a correlation, do you think that if all school systems taught children with autism a repertoire of helping behavior and safety skills in early childhood, the rates of independence would be higher among adults with autism? So if special education teachers or BCBAs taught children with autism early on different repertoires and categories of repertoires that of helping behavior and safety skills, like what their rates, if we did a long term study, if their rates would be higher in independence versus children who do not have that early intervention. Then my fourth question is, what made you become a behavior analyst and study this population? Just to figure out if there was anything that maybe happened in his life or anything they may have seen that made him want to choose this field. And in the future, what do you hope to conduct research on? And is there a certain area of interest you have not been able to study yet? Just some implications of his work. Dr. Reeves' work has been used to address how teaching children with autism a repertoire of sharing and other pro-social behaviors can lead to an increase not only in social skills but in safety skills. Children with autism are at a very high risk for being in unsafe environments and just being in dangerous situations. And his work impacts clinical practice because clinicians can use his repertoire to teach skills such as vocational skills as well, appropriate safety responses, and helping behaviors that can lead to the increase in the safety skills. So if they acquire helping behaviors first, they can clinicians can use those helping behaviors in a way to teach safety skills. And just that early intervention is essential for individuals with autism in order to have higher rates of independence in their future. And also, this work has impacted my life because I currently am a special education teacher and an ABA instructor, and this is something that I could bring to the school and just to help further teach the children skills and just how to better get a handle on helping them learn safety skills and social skills. And here's my bibliography. Thanks, guys.